Welcome to the presentation on traumatic brain injury. TBI, officially a low incidence disability, has its own category under the Individuals with Disabilities Education Act. It is a brain injury caused by an external physical force which causes total or partial functional disability resulting in long or short-term effects.
The prevalence of TBI in America is pretty alarming. It is estimated that every 23 seconds, a person in the United States sustains an acquired brain injury, and the individuals at highest risk are in the age groups from birth to 4 years old and from 15 to 19 years old. Approximately 20% of all childhood brain injuries that require hospitalization will lead to TBI-related disability for life.
TBI are known as the silent epidemic due to the fact that many children have no visible impairments following the injury. The symptoms of sustaining a TBI can vary depending on the extent of location in the brain injury, also how old they are when the brain injury occurred. The child may also be reluctant to admit that something is wrong if the injury was obtained through poor behavior or even participation in sports.
Injury stems from a physical blow to the head in most cases. Typically, the causes are simple things like falls, but they can also come from motor vehicle accidents, abuse, or neglect. The key to initial diagnosis is that the blow, whether an open or closed wound, results in disruption of communications within the brain. Symptoms are initially concussion-like and can range from a brief change in mental functioning to a severe extended level of disruption of cognitive brain function.
The full effects of sustaining a TBI may not be apparent until the child proves unable to perform expected learning tasks. Cognitive effects include difficulty learning new information, difficulty with multitasking, and lack of concentration. The student may be quick to anger and socially withdrawn or unmotivated to do work.
Effects on the child's academic ability may not be fully clear. It may be days or even weeks before the onset of the effects are displayed, when a child is asked to perform certain tasks and skills. Some of the more noticeable cognitive and communicative symptoms are expressed through a child's inability to multitask, problems with memory and recall, and a lack of concentration. Physical effects on academic ability are also apparent through dizziness, headaches, poor vision, changes in hearing, and fatigue.
We then already noticed a lot of the symptoms of traumatic brain injury have crossover with specific learning disorders of behavioral disorders. Similarities in diagnostic criteria cause TBI to be commonly misdiagnosed. The main reason for this is the lack of teachers aware of TBI and disability category, despite the fact that it is own category under IDE.
The most common problems in student learning and academics are similar to specific learning disabilities and behavioral disorders, causing TBI to be commonly misidentified. Difficulties with memory, attention, concentration, and fatigue are the most common among students, and these symptoms are typical of other more common disabilities. This contributes to the misdiagnosis of these students.
After a child returns to the classroom, there are noticeable impacts of learning during the initial stages of settling into the classroom environment. These impacts are more specific to learning outcomes and focus on the skills that students should be developing in the classroom depending on the severity of the injury. It can be up to a year before the students re-enter the general education classroom.
Returning to the classroom after a head injury, teachers need to be very mindful of the student's behavior and whether they express the previously explained symptoms. It is crucial that students get the school support services that they need in order to continue learning in the least restrictive environment. This is especially true for students who would be considered to only have a mild or moderate TBI, as studies have shown these students receive far fewer support services initially than those with severe.
Long-term studies conduct that the impacts of TBI on academic performance indicate that students with severe TBI have had a use of school services and a low school compensity. The education issues faced by students seem to be increasingly with age as more skilled learning demands are placed on them.
That children who suffer from TBI are more likely to fall behind their peers as they age, and executive functioning impairment persists with a decreased ability to process information. Extended time delay in processing causes students to return to work much slower than their peers, and over time this begins to affect a student's quality of life. This results in neurodegeneration, hyperactivity, and significant cognitive impairments.
A 2017 study of students with TBI found that children with mild or moderate TBI were far less likely to receive school support 2 years post-injury than 6 years post-injury. This means that the students are not getting initial support to prevent continued support services. We know early prevention helps students greatly, so proper diagnosis is
And teaching strategies for children in the classroom are centered on improving student concentration, memory, and processing, as well as helping develop executive functions. This focus is in the hopes of combating some of the more common effects of TBI-related disability, which revolve around attention span, learning of new skills, and acquisition of new information.
These students often have trouble concentrating, ensuring that all the slides and materials are easily digestible in a short period of time. To try and incorporate a variety of different engaging examples into presentations and new topics that align with the students' interests. It may be helpful to learn specific students' interests to incorporate them into the lesson rather than generalizing to what most students like.
Distractions in the workspace. These students have trouble with attention and concentration, so having minimal visual stimuli increases the likelihood that the student will be paying attention to the instruction happening at the front of the classroom. Having blank walls may not be appealing, but try to at least reduce distractions where the majority of the teaching will be happening.
Instruct students in strategies for self-regulations. Have these students practice self-monitoring to track their progress on assignments, goal settings to give them something to work hard for, and self-reinforcement so they can acknowledge their own success and build self-confidence. These strategies reduce disruptive classroom behavior these students are prone to and allow students to reinforce their own positive behavior.
Clear organizational process and classroom routine from the beginning of the school year. This should be done in every classroom, but it is particularly helpful for students with TBI because it creates clear, repetitive expectations that are easily recognized and executed. Creating an environment that is predictable helps these students feel secure and prepared when other aspects of the classroom may be much more difficult for them.
To differentiate your instructional methods, these students often have difficulties following directions unless they are clear and explicit. Give direction both verbally and in written form. Teachers should also frequently check for understanding, provide feedback, and give plenty of opportunities to respond.
As teachers, it is important to remember that TBI is a disability category under IDEA, although it is considered a low incidence disability. There are over 100,000 instances of childhood head injuries that result in ER visits every year, and about 20% of these will lead to long-term impacts for the child. Evidence shows that these students are typically underserved and misdiagnosed. What can you do in your classroom to ensure you are correctly identifying and teaching students with traumatic brain injury?